The virus has especially hit Michigan's prisons hard. More than 23,700 inmates have tested positive. More than 127 have died, but also among those numbers are members of the staff as well. With us now is Chris Gautz. He's the spokesperson for the Michigan Department of Corrections. Chris, thank you for being with us here on the MegaCast.
Yeah, thank you for having me.
If we could start out by extending our condolences. I know a member of your staff, one of the corrections officer, was also one of the latest to pass away from COVID-19. He was a father of four. Was it Romero Mata, who was with the Department of Corrections? And they're not just numbers, they're people. And it has to hit you and members of your staff pretty hard every day.
You're right. It does. Our hearts go out to the family, to all of the individuals who worked with that officer over the years. It really does affect people very difficult. It's been a very difficult time. And then when it hits home into someone that you've been working with for years, all of a sudden is no longer there. It affects not only the staff, but also the prisoners who have gotten to know some of these staff over the years as well, because they're losing people also. It's going to be a difficult time overall, which is why we're very proud of the fact that we established a wellness unit for our employees several years ago, and they've been a real source of help and assistance to our staff, especially during COVID, where there's a team of mental health professionals that can reach out and talk to staff and help them through some of these times.
But Chris, what is being done? Some are going to argue that enough is not being done to try to diminish the spread of COVID-19 within the prisons. But yet, on the backside of this, you are a prison. And how do you separate prisoners and individuals?
So we've been doing a lot. We've been very proactive from the very beginning. And we've talked about this before when I've been on, about all the steps that we've taken to mitigate the fact that we're the only state in the country that's doing this level of testing amongst our prisoners and our staff. Since early last fall, we began testing every single prisoner, every employee that works in our prisons every week. We've done more than 500,000 tests over the course of the pandemic, which accounts for about 5% of all the testing that's been done in the entire state. So we're testing every week. We're finding out where there's positives. We're trying to identify those individuals, separate them, quarantine them, do everything we can to keep people safe.
We can't seem to stop the spread in our communities. So I can't imagine the job that you and others within the Michigan Department of Corrections that you're up against right now. It's not an easy task. But on top of that, testing seems to or the issues with testing seems to be getting a little bit more under control, because in the beginning you couldn't even get a test. And there's still an issue of accuracy of tests. But now that we have enough tests, can we shift the focus of our conversation today on the vaccine? What is the status of being able to vaccinate members of the staff, but also the prisoners as well?
Sure. So the state health department put together their phase plan, which obviously now I'm sure everyone has seen, and our staff fall towards the front of that phase. So our healthcare workers that work inside of our prisons come first, according to the state health department's plan, and we have 28 prisons stretched across 19 different counties, and so we had to work with 19 different county health departments to coordinate how we were going to be able to supply the vaccine not only to the prisoners but also to our staff. So right now, all of those county health departments have gotten at least to the phase where our healthcare employees at our facilities have been able to be vaccinated. And now the next step is we're waiting for some of those counties to get to the point where they can offer it to the general portion of our employees that work inside of our facilities. Some are already doing that. Some are on the cusp of doing that. And we're really excited to get that started. And then on the prisoner front, we've made our request for the vaccines. And right now we're expecting, and our fingers are crossed, that the first shipment of vaccine for prisoners is going to arrive next week. We've been doing a ton of work for the last few weeks, if not months, to get prepared for that, get our providers in place, learn how to do the injections, have the refrigeration, all the testing that needs to happen on the back end, so that as soon as we receive the vaccines, we can start putting shots in arms. We've identified all the prisoners who are over the age of 65 and have them take a survey so that we know exactly who they are and if they want it once it arrives. And so once we get those, we're very confident that hopefully next week shots will start going in arms.
So you mentioned the refrigeration. So you've been able to purchase those refrigerators that keep the Pfizer vaccine at that super cold temperature needed?
So those are some of the discussions that we've been having, making sure that we're getting, because some need the refrigeration, some don't. There's a lot of particulars involved in that. So all that's being handled right now, making sure that we're ready to go once the shipments arrive.
There are so many different angles to this story as well, because there are people in the general public who say, hey, we can't even get it yet. Why should we be giving it to our prisoners? Your response to that?
Sure, I would say that obviously this is a congregate setting, and so our staff and the prisoners live and work in a congregate setting where it can be very difficult to control that spread. And so when our staff are going in, eventually they come out, they go home, they go to local grocery stores, they go out into the community, they go to church, their kids go to schools. They're caring for elderly parents. This is a crucial way to help stop the spread in the community by being able to vaccinate not only the prisoners but those employees, so that when they go home and when they go out to their communities, they're not at risk of spreading it further out into the state.
With that, Chris, can you tell us what is the procedure for some of the inmates as they're about to be released? Do they have to be tested prior to their release to make sure they're COVID negative?
They do. We do a rapid test, usually within 48 hours or so before they're to be released, to make sure that we know their status before they're released.
But with that, we also know the rapid tests aren't always accurate. Have you heard of any cases where you released an inmate and then they turned out to be positive?
Not to my knowledge. Again, because we're also doing weekly testing, PCR testing, which is very accurate. We have confident. It's just sort of an extra level of assurance that we're not releasing someone, especially if they're going to a congregate setting like a halfway house or a hotel or something. If they don't have family that's going to take them in, and if they do test positive on that, we do hold them back because we're not going to introduce someone who's potentially positive into like a halfway house or something like that. Now, if they're going home, if they're going to their spouse or to their parents or to a friend that they're going to live with, they can be released. But obviously, we make sure that that individual knows what their situation is, and they can certainly make a determination whether or not they still want them to come there, and we can work that out. But yeah, we do testing every week, and then also right before they walk out the door.
It's great to hear that because we're 10 months into this and so many things are changing on a day-to-day basis, but we do have to understand just what you said, that they're being released back into the public. And so in order to keep us safe, we need to keep them safe as well. But with that, can you tell us a little bit more about what is the procedure if you identify an outbreak in one of your prisons? Because we've had several through the past 10 months, which really was inevitable, right? It was going to happen.
Yeah, so when we declare an outbreak, obviously that really what that means is we're going to slow everything down. We're not going to have prisoners from various housing units going into the programs building to go to class. Think of it like a college campus. If you have students or prisoners from various residential halls all have positive cases, we're not going to then send them into a classroom and then have them go back and then potentially spread it further back to their resident units and so or their dorms. So that's kind of the same thing with prison. So right now we slow everything down. We cohort movement by their housing unit, so that way they're staying together with their group. They're not going out onto the yard and playing basketball or lifting weights with prisoners from across the whole facility. They're going to stay with their one unit. They're going to go to chow together. They're going to get their meds together. They're going to do all those kind of things together as a group so that we don't have spread. And then we also try to make sure that we, as best we can, limit staff movement in those units so that we don't have spread and people moving it from place to place. And so there's a lot of thought and care that goes into this so that we can try to do everything we can to limit spread wherever possible.
And with that as well, Chris, I will say, what is the status of visits for your inmates? Are they being allowed right now in person? And if not, when do you anticipate that returning?
So back on March 13th of last year, we had to suspend in-person visits because of the risk of introduction into the facility by individuals to protect not only them, but also our staff and the prisoners. And we want to get back to that, and our plan is to get back to that this year. We don't have a time and date set in place right now because, again, it's just It's just too. It's not safe right now. But we want to get there, and we will get there. So in the interim, what we've done, even before we had to suspend visits, our director worked with our companies that provide our email communication and our phone calls for prisoners, and worked it out with them so that they can provide some free phone calls, some free electronic stamps every week, so that they have some free access to communicate. And then we also went the extra step and started video visits. We did a pilot where we had about a half dozen facilities for the last few months have been doing a pilot with video visits. And we just announced in the last few days that we're going to be rolling that out statewide. And so within the next month and a half, all of our facilities should be up and running and having video visits, which costs the same as it does a regular phone call. And so we're really excited to get that going. And those will stay in place even once we get back to in-person visits, because sometimes it's easier if you live in Detroit, but your loved one is in Marquette or up in the UP, to be able to do that video visit. So you can still have that family connection. But then once we have in-person visits, if they want to make that trek, they can certainly still do that.
And we always say there are some positives, I think, that are going to come out of the pandemic for so many organizations that maybe wouldn't have happened before. And this could be one of them. But with that, the cost even for a regular phone call in the prison system can be pretty pricey. What is the cost for some of these visits?
Right now, it's around 16, 17 cents per minute. And that's a great reduction from what it was a few years ago. We really worked with our provider, and we said to them, because we started seeing stories and we heard from our advocates and family advocates saying that the costs were just too high. And so we almost shrunk that cost by half, because we went to the provider and said, look, we want you to keep this contract, but to do that, you're going to provide us all the things that you're already providing us, and you're going to lower that rate for families down to this, which again is around 16, 17 cents per minute. And they did that. And that was a great relief. It saved millions of dollars for families around the state to be able to who call in and want to talk to their loved ones. So that was really important for us to bring those costs down. And then on top of that, to ask them to provide free phone calls several times a week for the prisoners as well.
And that's good to know. With that, I don't know if a lot of people will even remember back in the day, like when you had, like we still have a house phone, but back in the day with long distance calling and all of that. So that's about what the rate was back then. But with that, Chris, what is the status at the beginning of the pandemic? We heard a lot about releasing nonviolent offenders to help stop the spread within the prison system. What is the status of that right now within the Michigan state prison system?
Yeah, so there's a lot of misnomers around that. So I'm glad you asked that. And so last year, we obviously just wrapped up 2020. And last year, we released more than 8,000 prisoners, which is about on par with what we've done in years past. And so some may wonder, well, why didn't you release more? And that's because since Director Washington has been in place since 2015, our prison population in Michigan has been reduced by 21%. And at the same time, we hit our all-time historic low in terms of recidivism at 26.7%. So we're releasing thousands and thousands of prisoners every year, and far fewer of them are coming back. So we had fewer people coming to prison, and then we're also fewer people coming back. And so the numbers of people that are in for nonviolent offenses is incredibly low. We just ran the numbers the other day. We looked at individuals who were in low security housing, who are in for small drug or non-assaultive offenses, and who are past their earliest release date. There were 61 people out of a population of 33,000 who fit that category. So when people say just release all the nonviolent people, it's a very, very small number. And again, about 85% of our prisoner population, again, which is about 33,000 individuals, are not eligible for parole yet because they've not served their minimum sentence. So we don't have any ability to release them under the law. And so of those that are eligible for parole, about 2/3 of those are serving for assaultive offenses, sex crimes, or homicide. And so, again, the number of people that we have the ability to parole is very small. And then inside of that pie, those who are in for drug offenses or non-assaultive offenses is only about 1/3 of that. So it's a very small number. Everyone who is eligible for parole right now in the Michigan prison system has been considered by the board, and everyone who's still in prison that's eligible for parole is someone who the board has looked at and deemed that they're not able to release in terms of public safety right now. But we're working hard on those individual cases, making sure they get that programming so that they can be released when it's safe to do so.
Chris, it's great having you on the show, and I so appreciate your explanation and your full explanation of so many of these things and the issues that we see behind the headlines. Anything that maybe we didn't touch on that you want to share before we let you go?
No, I think you covered it all. Again, we're just really excited to get vaccines going, to get in-person visits going at some point this year when it's safe, but also obviously video visits rolling out statewide. And again, just reminding people that maybe they hear those numbers. There are some who are going to hear those numbers and say, "That's great, but you should let more people out." There's also, we know, going to be people who say, "Why are you letting so many people out?" And again, for that segment of the population, I think it's important to remind them that our standards of parole have not changed during this pandemic. Again, every individual that's looked at is reviewed in person with an interview, and then a review of their case and what they come to the table with, and then a decision is made based on evidence. And that's why we've been able to release so many, and again keep our recidivism rate at an all-time low in state history.
Chris, thank you so much for your time. We so appreciate it.
Thank you.